Are you having issues treatment planning cases or thinking about how you're going to tackle this implant or surgery case? Well, if you're the dentist looking at this, these tips are just for you. Yo, what up? It's a tip of the week, and today we're going to discuss, are you having an issue treatment planning patients for oral surgery and implantology? All right, guys, if that is you, I want for you to get a pen and pad and write these tips down. I'm Dr. Jared Williams. I'm a concierge dental surgeon practicing in Houston, Texas, and all I do are implants, third molars, oral surgery, IV sedation, and coaching. And I got a little something to share with you. After 10,000 cases, I'm so excited to share with you all my tips and tricks so you can smile after surgery. All right, guys, so what I want for you to do now, hit the like button, subscribe, tell all your friends, smash that like button, because these tips are just for you. All right, guys, the reason why this is so important is because if you're gonna have success treatment planning, implants, and oral surgery, you can't have preferential treatment. So number one is this: treat the patient that's in your chair as if they're a prized family member or somebody that you love, cherish, and adore. That's really gonna eliminate a lot of the different challenges that you would be thinking, because if it's somebody that you love, you're probably gonna have their best interests. You're probably gonna be thinking, man, I know this individual and they're probably gonna nag the heck out of me. So I really wanna make sure that they're taken care of. And you probably wouldn't do any fringe treatment or any experimental treatments on them. So if they're a loved individual and somebody that's super duper fond to you, you're probably gonna do the best by them. And what better person to do great treatment on than the lifeblood of your practice, who I call your patients. Also, another tip that you could do when you're treatment planning your patients is when you come across a case and you're pretty stumped, don't ask yourself if I should do it, but ask yourself, should you do it? Because by asking yourself that open-ended question, it unlocks a chasm of possibilities that your brain wasn't otherwise thinking on that wavelength, and you're literally able to tap into that reservoir so that you can smile after surgery. So when you're coming up to that case and you're like, man, is there a good amount of bone? How's the soft tissue? That tooth is sitting close to the sinus. Ask yourself not if you should do it, but should I do it? Because if you should do it, or if I should do it, then you'll really be able to understand, hey, I need to take a step back, or this case just isn't for me. Number three is this. You know, when I go to different practices, I will sometimes get the doctor that loves to give preferential treatment to their family members. And I'm like, no. Everybody's getting treated the same exact way. And I want for you to do the same exact thing. You know, when I go to different practices, there's one case that happened to me before, and I was treating a patient, and I'm in the middle of doing surgery. I'm taking out a couple of bony impacted wisdom teeth, got my capper on, I have my 15 blade in my hand, I have my Minnesota retracted, I'm looking at the x-rays, and then I've started the section. I get this tap on the shoulder, and I'm like, and the doctor's like, hey, I want you to treat one of my family members. I was like, okay, get them in line. I got one, I'm in the middle of something, and two, I'm gonna treat them regardless. Of course, I'm not telling them that, but that's exactly the look. I'm like, I'm giving them. And so when the doctor comes in, she changes the x-rays on my screen, and I'm like, okay, well, just put them back when you're done and I'll get to the patient when I'm finished. So as I'm sectioning, getting the tooth out and irrigating, putting the flat back, I finish with the patient, say, hey, is everything okay? They're like, everything's great. Thank you for what you've done. I have my assistant give the post-op instructions, and I dismiss the patient. Now it's for that family member's time. Well, when I get in the chair, I'm speaking to the patient just like I'm speaking to you, and the doctor of the practice is sitting right behind the patient. And she's like, is everything okay? Is everything okay? Like mouthing it. And I'm like, dude, like, I don't care if it's the President of the United States. I'm gonna treat the patient the same exact way regardless. Guys, ever since I've done that, oh my goodness, there's a certain relief that happens. I can't remember if I read this or I saw these stats, but research shows, and once again, I gotta find this. Research shows that when you start doing preferential treatment, your care goes down. You can think of some of the scenarios where there was a special prize famous individual that a doctor botched the treatment. And I'm pretty sure the reason why the treatment was botched is because they look at the individual's name and they're like, oh crap, I'm treating this patient. But then the outcome is this right here. And you don't want to have the outcome of death. And so in dentistry, you very seldomly get situations like that, but you don't want to be known for, oh, there goes that doctor. And the way in which you do that is not treating anybody differently. I don't care if it's your family member, your spouse, your uncle, your aunt, your mother or father-in-law for that matter. Like, it does not even matter. Treat them all the same. Now, bearing you are treating all the other patients at a highest level, just like any other doctor would. But the reason why I give you these 3 tips is because I found that when you're treatment planning cases, it can be extremely challenging. And so after my decade long of practicing, I just want you to smile after surgery. So right now, before you go, smash the like button, subscribe, share with your friends and colleagues. And what I want for you to do is this: the story or the tip that was resounding to you, what I want for you to do is simply put it in quotes in the comment section so somebody around the globe can literally smile after surgery. Because there's no stupid question, guys. Trust me, I know. All right, guys, I'm Dr. Jared Williams, and my focus is for you to remember, what looks hard is often easy. Make it a great one.